Hi, everyone, and welcome to Workforce Wow Coffee Breaks, a series dedicated to bringing you the latest trends and strategies for positively impacting some of the post-acute care industry's greatest challenges, including retention, turnover, training, compliance, and more. And because we know that providers do not have much time to spare, we're going to do it all in 15 minutes or less, about the same time it takes to finish a cup of coffee. So fill up your favorite mug and let's dive in. Our topic today is dementia care training, preparing your team for the growing need. So today I'm joined by Emily Scarborough McFadden, the VP of Content and Instructional Design here at showd.me. In her role, Emily designs solutions that help home care agencies, skilled nursing facilities, and therapy providers navigate the complex regulations with confidence. With a deep understanding of workforce training and industry trends, she focuses on making compliance education practical and easy to apply in real-world settings. Emily enjoys breaking down the regulatory changes into clear, actionable insights and sparking conversations about what really works when it comes to training and staff development. Emily, let's go ahead and dive in. To start, can you share a little bit about the current regulatory climate when it comes to dementia care training?
Yeah, thanks, Carrie. That is a really great question. At the federal level, dementia-specific training is required in skilled nursing facilities, and that really focuses on person-centered care, behavior management, communication strategies, and there's also an increased push to limit the inappropriate use of antipsychotic medications in people with dementia, something that proper staff training can really, really impact. And alongside that, at the state level, we're seeing more and more mandates for competency-based training really across the post-acute care continuum, not just requiring staff to take a course, but to really demonstrate real-world skills. These regulations specifically vary, but the trend is very, very clear that dementia care training is not optional at this point. And in that regard, compliance is just the baseline. When done right, dementia care training really does go beyond those mandates and equips caregivers with knowledge, confidence, practical skills that allow them to provide really high quality care, doing so in a way that centers the individual with dementia and also moves the needle in terms of things like staff burnout, behavioral incidents, those things that are top of mind for many folks who operate in this space. The goal isn't just meeting a requirement, but really creating an environment where both individuals with dementia and caregivers are able to thrive.
What would you say are kind of those top challenges that employees might encounter just kind of based on, the behaviors that can shift with a diagnosis of dementia?
That's a really good question. So, we all know that caring for someone with dementia requires patience and flexibility and an understanding of who they are as a person, as well as how the disease progresses. And oftentimes, the challenges that caregivers face stem from that complex interplay of those different factors. So, understanding and responding to changes in behavior, that's a challenge that caregivers often face. Um, Training can help support that by equipping caregivers with the knowledge and skills to understand how behaviors like restlessness or confusion or agitation can be responses to certain triggers and how to navigate those effectively. Breaking down communication barriers, communication challenges are another very common thing that caregivers and individuals with dementia face as the disease progresses. Individuals with dementia might struggle to find the right words to express how they're feeling. Being able to navigate both verbal communication and nonverbal communication effectively is another way to navigate through some of those challenges. Another area where we see caregivers and individuals with dementia challenged is kind of that balance between independence and safety. Uh, it's always our aim to ensure that independence is centered, that a person's individual goals and aims are centered, but there's also a consideration with the progression of the disease as that need for independence needs to be balanced with safety and safety precautions as well. And doing that in an ethical and safe way is another challenge that effective training can really help support. And then, as we've talked about earlier, caring for individuals with dementia can be emotional and physically demanding. Seeing someone struggle with memory loss, confusion, can be very challenging. And without the right support and without the right training, caregivers are more susceptible to experience the stress and burnout that so often does come with that role.
So, all that being said, what would a comprehensive dementia care training program really look like?
So, a comprehensive dementia care program should be practical. It should be engaging. It should include competency-based education. So, really, something that goes beyond checking a box to instead focus on the real-world skills and abilities that someone needs to be a successful caregiver, a empathetic and a person-centered caregiver. I'd say the most important topics to cover include things like understanding dementia, the progression of the disease, its stages, person-centered care strategies, and how to tailor care to individual needs, especially how these needs might change and adapt with the progression of the disease. Behavior management, of course, we talked about that a little bit earlier. So, recognizing triggers and strategies for providing person-centered interventions, knowing that those interventions really don't look the same across all of the different people that one might be working with. Effective communication strategies, verbal and nonverbal strategies to help connect with the patients and validate where they are in terms of their own reality. Um, the kind of tactical skills of supporting activities of daily living and helping patients with their activities in a way that's dignified, as well as self-care strategies, preventing burnout and managing stress, knowing that that is something that comes up quite often in the role as well.
Yeah, absolutely. So I want to touch on a few of those things and go a little more in depth, but let's start with this idea of person-centered care. I mean, it's a care model that the industry has been kind of slowly shifting towards over the years. So how would you say person-centered care can be best applied with the dementia care population?
That's a great question. I would say that person-centered care really, when it's totally boiled down, comes to seeing the individual first, not just the disease. So instead of a one-size-fits-all approach, caregivers who focus on understanding personal history and individual preferences and who are able to and equipped to incorporate things like someone's favorite activity or their music or the foods that they love into their care, that is a very practical, very tactical way to center that individual rather than the disease. Promoting autonomy, allowing patients and individuals with dementia to make choices whenever possible, or providing the opportunity to select from options in the case of caregiving. So, would you like to wear this scarf or that scarf? It's cold outside today as a way to center individual choice and individual preference while keeping it sort of contained within a safe environment as well. And then building connections, encouraging caregivers to use life stories to help create meaningful interactions with the people that they're caring for. That kind of creates a bridge between the interpersonal connection and also a deeper understanding of the history and preferences of that individual that help the caregiver create interventions and create an environment that is really centered around that person.
Another thing you touched on within training is this idea of kind of how caregivers can best respond to some of the behaviors that may result as, the symptoms of dementia progress. What are some de-escalation techniques that caregivers should be aware of, that might be different than a de-escalation with, a typical resident who maybe is not faced with a dementia diagnosis?
That's great. That's a really good question. So I'll start out by saying that dementia-related behaviors can absolutely be challenging, but they are rarely totally unpredictable. So the aim, as I see it, is to equip caregivers with the strategies to support and manage those behaviors, starting with early intervention, identifying triggers that can contribute to these things like pain or hunger or overstimulation, so that we can create an environment that really prevents those behaviors from escalating to begin with. Um, I, Identifying where that person is in their own reality is another effective way to manage dementia-related behaviors. This is where validation therapy and other similar strategies can come into play. So instead of arguing or correcting, acknowledging that individual with where they are in their own reality. So, for example, you might hear someone say, I need to go home. It's time for me to leave. And instead of saying, no, you are home, you could say something like, tell me more about your home. What do you love about your home? Kind of redirecting it into a positive way without introducing any friction into their own reality. Using calm, clear, reassuring communication, so slower speech, gentle tones, especially as the disease progresses, the use of nonverbal cues becomes especially important as well. And in addition to that, when it comes to managing dementia-related behaviors, redirecting attention to something soothing or positive can be another really important tool in the toolkit. So a classic example of that is when it comes to wandering. Wandering is very common, and our goals as caregivers is to ensure that people can participate in that in a way that's safe, that allows them autonomy, and centers them as an individual, but also make sure that they're not going to put themselves or end up in an unsafe situation in any way. This also points towards environmental adjustments. Sometimes environments themselves can contribute to these challenging behaviors. So things like noise levels, lighting levels, distractions that might cause a sense of overwhelm can be controlled as well. So by looking at identifying triggers, validating where that individual is within their own reality and sort of providing calm, productive redirections and environmental adjustments, we can help prevent these situations from escalating and make dementia care less stressful, both for the caregivers, but especially for the individuals with dementia as well.
We've talked a lot about those working directly with dementia care patients, but should dementia care training stop there?
That is a really good point. And I realize I have talked primarily about caregivers so far, but in any of these organizations where our role is to provide kind of comprehensive care, person-centered care, that knowledge and skill is not strictly limited to folks providing direct care, especially when it comes to community and family engagement, how to effectively integrate and support people whose loved ones have a dementia diagnosis. They're a very, very important part of the ecosystem. And, regardless of what role we hold within an organization, we do know that the common thread is supporting an environment where person-centered care, where high quality care is front and center. So while there's some very practical, tactical skills that can be addressed through dementia care training for people who are providing direct care, the benefit is not at all limited to just those who are providing direct care.
So to wrap up things here, can you just share a little bit about showd.me's dementia care training?
Absolutely. So, showd.me's dementia care training is built on best practices and regulatory standards, pulling from practice guidelines from CMS, from the National Alzheimer's Association, from key states that have defined their own dementia care competencies and criterias, to ensure that caregivers are well prepared to support the individuals that they work with. More specifically, our program includes person-centered care strategies, managing dementia and its related behaviors, including de-escalation and intervention techniques, effective communication strategies, including verbal and nonverbal, environmental strategies, and how to support an independent and safe environment, as well as self-care strategies for caregivers, including how to incorporate family and community in dementia care as well. Beyond the courses themselves, we also offer a fully managed solution. So rather than just a course catalog, this includes handling tracking and completions, really taking you a couple steps beyond compliance and allowing you to adapt training to your organization's specific needs while also focusing on all of the different elements that you have going on beyond just training compliance.
Yeah, absolutely. All right. Well, thank you, Emily, for everything that you shared with us today. And thank you to all of the providers who are listening in. As Emily just mentioned, Showed Me's Dementia Care Training Program is built around those highest standards, but we can also customize it to meet your needs. And it doesn't have to stop at dementia care training. We have a whole range of courses to make sure that you're meeting all of your compliance needs. But as Emily touched on, what truly makes us unique is that we go beyond just providing that content. We take on all the heavy lifting of keeping your employees current and compliant with the latest training requirements so you can focus more of your time on what matters most, which is delivering the highest in quality care and service. So if you're interested to learn more about Showed Me and what makes us unique, please visit us at www.showd.me. We'd love to connect with you and give you more information. But in the meantime, thank you again for tuning in to this Workforce Wow coffee break, where small sips lead to big impacts.